Good morning. Feeling good, actually. Sure. Sure, sure. So my name is Niala Dupree Walker. I am a teacher here in Nigeria. This is actually my first year living here in Nigeria. I'm a teacher at ASFA, the American International School of Abuja. And yeah, I've really been enjoying Nigeria so far. And yeah, that's a little bit about me. I'm from the U.S. originally, but I've been living here on the African continent now for this is my fifth year. Sure. So essentially, I started having some very abnormal pains, some excruciating pains around the time of my period where that were just, very abnormal for me. I've had a very consistent period for 30 years. And then about 6 months ago, it started to just become very burdensome, very, very painful. And I knew something was wrong. I, at the time, was seeing a fertility specialist, and so I asked them to do an ultrasound. And when they did that ultrasound, they said, "Oh, we don't see anything." And about a month after that ultrasound, I was rushed to the hospital from work, from my classroom, because I was in so much pain and cramping so badly that I couldn't even go on with my teaching. And so at that hospital, one of the local hospitals here in Abuja, they did find an ovarian cyst. And so they saw, a rather large, cyst that was developing in a growth. Um, and from there, I knew that I needed to, and that was, the ultrasound that they do over the belly. And so from there, I knew that I needed to do, an intravaginal ultrasound. And so I was connected by our wonderful school nurse with an OBGYN doctor, and I can't exactly remember his name at the time, but he confirmed that there was a cyst there. And he said, it looks like if it's giving you this much distress, it needs to be removed. And that's how I was connected with Dr. Akintobi. And since that time, I've also connected with another fertility specialist who, her name is Dr. Khan, and she actually highly recommended Dr. Akintobi. And so she said, if you already have consulted with him and have met with him, you should go forward with the surgery with Dr. Akintobi. I felt good. Like I said, the staff here have done an excellent job. I'm an American woman, highly educated woman, so I came with a lot of questions and a lot of demands. And I actually was quite impressed with the way that the staff and the doctors really answered every single question, always answered my inquiries, were very quick, to respond on, WhatsApp. Okay, Mom, we're going to do this. You can come visit on this day. We're going to connect you with, different people who have also had services here. So all of the things that I, wanted to have in place to make me feel comfortable about doing the surgery here, ASFA was very, very responsive. Um, like I said, so my first experience was just in the kind of the exam rooms. And so, the exam rooms were, nice, clean. They have a nice, reception area with a nice TV. I had a friend with me, so she was able to, be comfortable. And I did like that the ultrasound equipment that they were using looked like really, modern and up to date, like the, most up to date technology. So that was good. Sure, sure. So, yeah, they were really good in the, weeks leading up to the surgery, kind of saying, okay, you need to come in for this blood work. You need to do, we need to just run a battery of, blood tests and urine analysis and different things. Actually, even Dr. Nehemiah wanted to run like a special test to potentially test to see, I guess, if there might have been some cancerous traits or something like that. So I feel that they were very thorough in doing like a pre-surgery, check of everything, of all of my, vitals and my current status to, get the best assessment. And then the week prior to the surgery, they put me on like a couple of medications, and were even before I asked, they sent me like, okay, this is your diet each day, before you come in for surgery. So maybe I didn't follow that diet as closely as I should have, but they were very thorough and very clear about what I needed to do, to prepare for surgery. I even liked that they had me come in the day before, so that put me at ease, so that I was here, I was able to have a good night's sleep and rest, and then the surgery was done first thing in the morning on Saturday. For sure. So I had a laparoscopic cystectomy. So yeah, so laparoscopic cystectomy with in the endometriosis treatment. And so they went in for, kind of looking at multiple things. And so there was endometriosis, there was a cystectomy, there was some, tubal ligation. So, I kind of had multiple issues. And so, but they, treated me for, I guess, the endometrioma and the cystectomy. I do actually. Like I said, most every question that I asked, and there were many, questions, they were, always very receptive. I remember the first time I came, I think my consultation was over 2 hours that I was here, and they listened to all of my questions. I had a friend with me. She asked questions. I had questions on my phone. Other people sent me, and they allowed me to really be comfortable and go through every single question. I was quite confident. To be honest, I haven't had, because I've now lived outside of the United States for about, this is, I believe, my seventh or eighth year living outside of the U.S. I haven't had a lot of interaction with American healthcare in a while. And I was actually considering going to Thailand, because I have some friends here in Nigeria who have gone to Thailand for surgeries, or maybe Dubai, or maybe Turkey, to different places. But to be really honest, I have a really good community here. My life partner also lives here, in Nigeria. So for me, the kind of the major factors were, one, that several other doctors had really spoken of how competent and how good Dr. Akintobi is, and that he is one of the premier doctors and surgeons in his field for endometriosis, and that he specializes in endometriosis treatment. And one thing several people honestly said to me was that they said, if you were going for some other surgery like a hip replacement or a heart surgery, then you should go outside of Nigeria. But they said, but one thing that Nigeria does very well is babies. And so they said, so Nigeria has a very good reputation of dealing with, reproductive issues. And so if you're having something to do with, your uterus and ovaries and reproduction, that Nigeria, is very competent in those things. And so hearing, from multiple parties that, gave me the confidence to, get this treatment done here in Nigeria. Then I could also be close to home. I have a really great support network here through my school. I live on campus with a wonderful community. So for me, it made more sense to be able to stay put. My mother was able to come. So it just really all worked out to have it done here in Nigeria. Um, yeah, so the morning of the surgery, I was up quite earlier than I like to wake up in the morning. But it was fine. They got me up. I, again, am not a morning person, so I just wanted to sleep. I didn't want to get up and bathe and move around, but they insisted that, I get up, that I, bathe and get, ready and, be prepared for the surgery. They had already kind of, been very clear with me about the procedure and what we were going in to look at. So, clearing the endometrial tissue, removing the cyst, looking at the fallopian tube. So they had already been, really clear with me about the procedure. So, just going in, I felt very confident. And because I've been in, so much pain and distress and losing sleep and having, gastro issues with, my stomach, with my bowel movements, it's been really an ordeal these last 6 months. I was quite ready to get the surgery over with, and I was really impressed with all of the technology. I think there was a team of 5 or 6 people there. So seeing the whole team, seeing all of the machinery and technology, my anesthesiologist came in and met me, before the surgery even happened. So I was ready to go. Um, to be honest, I was under for a while. So after surgery, I felt horrible. I felt like I had been hit by a truck. Um, I couldn't barely move my body. I felt like they were like weights holding my body down to the bed. So right after the surgery, I was very, very exhausted, very much, out of it. And that night, I don't even remember much. I know that there were some visitors that came, and I couldn't even speak properly because I had had the breathing tube. So, yeah, so that first, you know, right out of surgery was very bad. It was not pleasant. Extremely tired, extreme fatigue, and just like I said, I haven't been in any pain though since I came out of the surgery. I haven't had any major pain, so they've kept me very well medicated. But just in terms of the fatigue, it's the most thing, and like just feeling very stiff, in my body. But I've been for the last 3 days even up and walking and moving and up and down the stairs, and have had bowel movements. So to be honest, the recovery has happened a lot more quickly than I expected. Sure. So, again, I think I stated earlier that I really haven't had a ton of experience with American healthcare in a while. So I will say the hospital experience is a bit different. So for instance, one of the things that I came in to do was, to tour the hospital and kind of see the facilities and what things were, are provided to come in. And so because I did that, I knew, okay, I'm going to bring in, some blankets, some pillows, bringing in my toiletries, bringing in food, bringing in different things. And so, but to be honest, I recognize, and one of the reasons I chose ASFA is because it's a smaller hospital, and I knew that I would get very specialized care. I knew I would have a personal nurse. And so it's compared to the US, there are fewer amenities, but I think that the level of care has been excellent. Yeah, I think it's just a level of attentiveness. I have been very, very spoiled by my nurses. I've had a daytime nurse, Miss Fatima, and a nighttime nurse, Miss Omoese, I believe her name was, and they have just both been excellent and very, very attentive. They have helped me with every little thing. Anytime I called out nurse or Miss Fatima, or can you come help with this, they are right there. I mean, so just immediate excellent care, helping with everything, very attentive, really catering to my whims. Also, my mother has been here with me staying the nights, and so they've also been very helpful with her, very nice to her, making sure, she's eating and getting everything she needs. So the hospital staff, I mean, have felt like a queen since I've been here. The hospital staff has really been excellent. No, like I said, the facility, like I said, I've seen the cleaning lady, the housekeeper, she comes through every day. The staff has been really good about making sure, I see them putting on their gloves every time. They're, doing a good job keeping everything sanitary, cleaning the wounds, even changing the linens on the beds and things like that. So, like I said, they've done a really good job, just maintaining, the sterile environment and things like that. So, yeah, it's been really impressive. But like I said, most of all, it really has been the care and attention of my nurses and the two main doctors that I worked with, Dr. Nehemiah and Dr. Akintobi. And even, and I feel like this is also a family affair, even Dr. Akintobi's wife has been here. She has come in to check on me. And so it really has, they've made me feel like family. I feel surprisingly good. And it's almost scary because I'm like, oh, I thought I was still going to be like feeling, like very slow, very lethargic, not being able to walk because I have, I know some other people who have had, myectomies and endometriosis surgery, and they said they were, out of commission for a while, not being able to walk and not being able to sit up in bed. So I actually feel pretty good. Like I'm able to stand for long periods of time. I'm able, to walk and move. I'm able to mostly bathe myself and, use the restroom. So I feel good. Yeah, I'm feeling surprisingly not totally back to normal. Like I'm still moving slow. Everything is at a very much slower pace. I still can't do, certain movements as easily, but um, for what I thought that I was going to take like at least 1 week to be, recovered, I'm much more progressed than I expected at this point. Yes, I do. I do. I think that I know that they are going to, tell me about, the medications, the timings, the cleaning of the wounds, and things like that. Oh, that's also another thing I want to make note of in terms of the laparoscopic surgery. So I am very particular about my skin. And so this surgery for me, having scars and cuts, I'm like, I hate, having any blemishes on my skin. And so it was a major point of concern for me. And so coming out of the surgery, they ended up doing 4 incisions. And of the 4, there's one large incision that they had to put for the camera. But the other 3 are so small, you can barely see them. It looks just like a little, almost like a little pin mark. So not even, I thought there would be a lot of like bruising, that I would be black and blue. And I mean, it's almost amazing in some ways how small, those incisions are. So I'm really impressed when they say that ASFA does, high tech, surgery and procedures. It really is. Like I said, with the exception of the one, scar that, you can see that's a little bit larger, the other ones are very minuscule. Absolutely. Absolutely. Like I said, Dr. Akintobi was highly recommended to me, and they, like I said, the care here and just their level of, just knowledge and competence and just being really thorough about explaining everything to me, even the other day after the surgery. It was almost a little too much. They brought me to the vials of tissues that they had removed. So I was able to see these are the parts that they took out, from your ovaries. This is the vaginal tissue they took out. This is, tissue from this part. And so I'm able to look at, oh, this is my appendix. This is this. So they have been very thorough. So yes, I would definitely recommend, any woman that is really struggling with this endometriosis. Dr. Akintobi really is a specialist, and I think they, have done an excellent job. So yes, I would tell someone to come here. No, I just want to say it's been a really good experience. This has been very scary for me. It's my first surgery. It was the first time I had had any major medical complications. I've been telling him, I said, this is the first time I've had this much interaction with any hospitals, anything, because I've been relatively healthy for 40, almost 42 years now. And so for me, it was overwhelming to be going from this hospital to this OBGYN to this one to this one. And so I'm really happy that I found ASFA and that, I was able to get the surgery, and I already feel, lighter, and I'm really hoping, for a very successful recovery.
All right. Thank you so much.
Thank
I
you.
look forward to seeing you at your review in 2 weeks.
Yes.
I'm sure you anticipate seeing having a video session with your consultant.
Yes, I'm excited to see what they found when they went inside.
Yeah, I'm sure it's going to be an interesting one. All right.
All
See
right.
you in 2 weeks.
Thank you.
Bye.